The number of coronavirus cases around the world crosses the 5 million mark, more than 1.5 million of them right here in the United States. Hello, I'm Arnold Naidu, and this is The Heat. The World Health Organization is warning the coronavirus pandemic is a long way from over. Latin America is seeing a surge in cases, with Mexico emerging as one of the hotspots. More than 54,000 people have been infected and over 5,000 people have died in that country. More on Mexico later, but first let's go to CGTN's White House correspondent Nathan King. And Nathan, US President Trump visited the battleground state of Michigan on Thursday. He seems to be in full campaign mode. What happened there?
Well, I think you're absolutely right to mention that because, as you know, US President Trump doesn't really like being at the White House. He loves being out in the US doing campaign rallies. But in this age of social distancing, he can't hold rallies. So this is the next best thing. Remember, last week he was in Pennsylvania in the Lehigh Valley, a very swing area in that state that helped him win the presidency. And again, in Michigan, which just for a few thousand votes also helped him get into the White House. Now, the optics of this are quite incredible because, as you know, Michigan has suffered quite heavily under the COVID-19 pandemic, 5,000 deaths, over 50,000 cases. And Gretchen Whitmer, the Democratic governor of the state, is very popular, but the US president has really been sort of critical of her over ventilators, first of all, and then encouraging demonstrations, some with heavily armed people going into the state capitol in Michigan, Liberate Michigan, remember one of his tweets, and now he's arguing with her about mail-in voting come November. He doesn't like it because he says there's fraud, but essentially there's no evidence of that, that actually it tends to make people vote more. So this war is sort of continuing, and as he arrived in Ypsilanti, Michigan, he went to the Ford plant there, which has actually been partially retooled to make ventilators. So it was a nice backdrop for him, but you know, even the music that you hear at his rallies was played as he entered and left. And you know, there was this big debate, and he essentially is the cheerleader in chief at the moment, trying to perhaps too optimistically say the economy is turning around. And he said, look, June and July, we're going to see great numbers. Things will be back by the fall. Next year is going to be even better. Every economist suggests this is not going to be the V-shaped recovery that we had been expected. But remember, he's facing re-election, so he kind of needs those numbers to be up. So it was a very interesting backdrop. And there's this whole debate now because he wasn't seen wearing a mask, although he insisted he wore a mask behind the scenes at the Ford factory. And the Michigan Attorney General and others had said, look, it's Michigan law to wear a mask right now. So there's all this debate. And Michigan is opening up. But Gretchen Whitmer, the governor, is basically saying, look, we're going to do this slowly. And he's saying, no, we need to open up quickly. But the problem is, of course, if we see more cases, we're going to have to lock down again. So there's this huge push and pull between lives and livelihoods played out by the president and whoever he decides to criticize.
Right, Nathan, talking about opening up, 50 states, all 50 states now taking steps to reopen.
That's right.
That's as the administration pushes to get the nation's economy back on track. But we are still seeing a spike in jobless numbers.
Oh, spike is the wrong word. I mean, it's a deluge, isn't it? 2.4 million today. Now, normally that would just be a blowout figure, but it's actually the lowest figure we've seen in 9 weeks. We have now 38.6 million Americans that have filed for unemployment benefits in 9 weeks. This is even bigger than Great Depression numbers, and it's just crushing. Now, obviously, parts of the economy are reopening, and they do hope that a lot of those jobs come back, but not all of them are. You know, any company that wants to sort of cut the fat a little bit, even in these times where it's good to be patriotic, will do so or try to do so, even though they're being paid to retain jobs. Plans for automation, things like that, are going to be put forward. And not all these jobs are going to come back. And unemployment insurance could run out in July unless it's extended here. So this is a major, major problem. You know, other countries have guaranteed incomes for a certain amount of time. The US has done it slightly differently. So we'll have to wait and see what happens. But, you know, you can tell the US president, you know, his idea of stimulus is literally opening up the country again. The problem is when you see a spike in people going back to work, you could see a spike in cases of COVID. Now, we've seen it slightly in Texas. We haven't seen it in Georgia. Have we seen it in Florida? There's a debate about the numbers. We don't really know yet for the next couple of weeks how this sort of reopening is going to go. And remember, fundamentally, still, the huge engines of this economy are still shut down. Los Angeles, New York City, here in Washington, D.C., although we're getting some good news from Washington, D.C., we were set to lift some restrictions around June 8th. Looks like the mayor may be about to announce that could come as early as May 29th. So you and I could have a cup of coffee in the next couple of weeks.
Look forward to that. Thanks, Nathan. Nathan King there for us live from the White House. Thank you. Now, earlier I spoke with Arturo Sarukhan, the former Mexican ambassador to the United States. Mexico has the lowest testing rate among OECD countries. And I asked the ambassador if that's likely to change in the coming days and weeks.
There's been a lot of pressure to augment the testing. There's been even sort of some back and forth between governors who are asking to be able to even acquire kits to do testing at the state level. The federal government has still been pushing back on that. But if the tally, and particularly the tally of fatalities, continues to grow in the coming days, there was another record high number yesterday. The pressure might be on, and they may have to start finding ways of doing much more accurate and broad testing than what they've done so far.
Do state governors in Mexico have broad autonomy to impose their own kinds of restrictions and measures?
They have a certain degree. It's not as robust a federal system like you have in the U.S., but it's pretty close. Governors have a significant leeway. The problem is that so far, in regards to the sanitary aspects, the epidemiological aspects of the crises, the federal government, the federal health authorities have taken the lead. The governors have had quite a large bandwidth of action in terms of some of the specific measures in state or in the specific municipalities, particularly as it comes to social distancing measures, to ramping up and reactivating the economy, which 3 additional essential sectors were added as of last week to the essential sectors list in Mexico, obviously because of the desire to try and mitigate the dislocation impact on supply chains in North America. The fact that there are essential sectors in the U.S. That have been open for business that depend on supplies and production and manufacturing capabilities in Mexico. So as of June 1st, there will be a new series of sectors that will be added. This has been designed in tandem with a sort of a traffic light, red, yellow, and green, that will allow municipalities, depending on the numbers of contagion cases within each one of those municipalities, to start ramping up and reactivating the economy. And that is the decision that the governors and the mayors of some of these cities will be able to take on their own.
Is there some kind of a disconnect between small businesses and government authorities, whether they be state or federal? There was a report in Bloomberg News, where it said that the government has given the green light to small businesses to reopen, but in many instances they're refusing to reopen because they fear a spike in infections.
Yeah, there's a bit of this going all over the place. There are mayors, for example, and governors who, despite the fact that, for example, the manufacturing of anything that has to do with the transportation sector, aerospace, automotive, has been now added to the list of essentials and will restart operations on June 1st. There have been a couple of governors who said, no way, because we fear that by reopening these sectors, we will trigger new cases, and they have been adamant in reopening, even though the federal government has now added those sectors to the list of essentials and has provided guidelines for sanitary healthy operations in some of these sectors. So that you do see, as you've seen probably here in the U.S. too, Anand, differing degrees of lack of coordination between municipal, state, and federal authorities.
Ambassador, what is the situation in the greater Mexico City area? This is an area with a population of 21 million people, more than 21 million people, many of them living in very high density neighborhoods.
Well, it's as you say, given the density and the size of the population in the metropolitan area, no surprise that Mexico City has the highest rates of contagion in the whole country. Following Mexico City is the neighboring state of Mexico. It's like Maryland and DC, which surround Mexico City, the metropolitan area. The state of Mexico is the second state with the largest number of cases, of registered cases, and of fatalities. Mexico City, the mayor of Mexico City has indicated that she will probably try and reopen some activities and lessen some of the physical distancing measures that have been in place for the past month and a half by mid-June, but obviously that will be predicated on the number of cases in hospitals in the Mexico City metropolitan area. If they go below a certain threshold, those reactivation plans will forge ahead in Mexico City. But if those cases remain high, if occupancy of beds in hospitals remains above 64% of all available beds in the hospitals in the metropolitan area, the Mexico City authorities have said that they will push back those reopening plans.
There are reports, very disturbing reports we're hearing from Mexico, where healthcare workers, including doctors, are being attacked because of rumors or fears among people that they, in fact, are the ones spreading the virus. What are authorities doing about this? Well,
this has been a very unfortunate, there have been a series of unfortunate incidents in Mexico. Health workers are on the front lines of containing and mitigating this pandemic. And there have been cases where individual cases or in some municipalities, so both governors and mayors and federal authorities are taking measures to protect healthcare workers, for example, providing them with specific modes of transportation so they can get to and from hospitals and clinics to their homes. And there's been a very aggressive campaign both by NGO and civil society watchdogs and by federal and state governments trying to underscore the important role these men and women play for the public health in Mexico.
We are hearing, analysts are telling us that the Mexican economy will contract by up to 7.5% this year. What is the broad impact that this is having on the Mexican economy?
The Mexican economy will be in dire straits, and I have no doubts about this. The impact will be severe. The fact that Mexico was already on a contraction route before the pandemic hit has added to the seriousness of what this will entail in the coming months. But at the same time, Mexico has a unique strategic opportunity to build upon the strength of those integrated joint supply chains and production platforms that we have developed in North America over the course of the last 20 years because of the North American Free Trade Agreement. If Mexico can build upon that strength, if Mexico can ensure that supply chains are unaffected as the economies of Canada, Mexico, and the United States start firing up motors, this could be a very important strategic turning point, not only in the economic fortunes of Mexico in the medium and long term, but could place North America at the center of a manufacturing and economic boom and recovery in the coming years, as many operations that, for example, were in China because of the trade war between the US and China, and now because of the aftermath and some of the effects of the pandemic there, are looking to bring those operations closer to the US continental area, and therefore Mexico becomes extremely attractive if Mexico does its homework in strengthening these supply chains and production platforms that crisscross the North American region.
Ambassador Arturo Sarukhan, thanks so much for joining us, sir.
My pleasure. Thank you for having me.
Now, to talk more about the global impact of the COVID-19 outbreak, let's bring in our panel. Joining us from Beijing, Einar Tangen is a political and economic affairs commentator. Steve Chaggaris joins us right here in Washington. He's a political analyst, and also with us from DC, Garret Martin is a professorial lecturer at the School of International Service at American University. Welcome to all of you to the show. Einar, let me start with you, and let's start with those very important big meetings taking place in Beijing right now, known as the Two Sessions. What are delegates been saying about the reopening of the Chinese economy in the wake of this pandemic?
Well, they're like everybody else, they are worried about any kind of second spike, but right now, China is pretty much back to normal. Not necessarily if you're going to a soccer game or a football game, as they say here, or basketball or entertainment, movies, etc. But in the restaurants, as I witnessed last night, people are back, the streets are full, unfortunately, so are the traffic jams. So I think this is a kind of reflection. They're concerned to make sure that this is not a repeat, that there's not a big second spike. I think they're looking a lot at what's happening in the U.S. and are very concerned. They'll be watching very carefully. If there is a big spike, I think a lot of them will feel justified that the government has been doing the right thing all along.
Steve Chaggaris, some relatively good news here in the United States. Dr. Deborah Birx of the White House Coronavirus Task Force had an announcement for us. She said that hospitalizations have dropped by 50% and the number of people dying from COVID-19 has also dropped in the country. So where does that put the United States in terms of reopening?
Well, you're starting to see, I mean, every state right now has started the move to reopen. Some states are moving slower than others. And, you know, the big question is how confident are Americans going to be in terms of going out and patronizing businesses or slowly getting back to normal in terms of living their lives? That's a big question. The president, as we've heard repeatedly for the last several weeks, is trying to really speed that up. I think he wants to try to juice this economy quickly. He realizes the economy is really the basis for his re-election campaign, and to have a sluggish economy or a tanked economy under his watch is not something he wants. And so the question we're going to be watching moving forward is, how quickly will Americans, yes, the states can open up and they can open up at different speeds, but how quickly will Americans get back out there and feel confident that they're not going to get sick once their states open up?
Steve, as you say, all 50 states are now in some stage of reopening, but what do you make of there seems to be a disconnect here between the opening up of states and the fact that the jobless numbers are also going up?
Yeah, I think, well, first of all, there's a little bit of a delay on the jobless numbers, and it's going to be interesting to look at those numbers moving forward. There's the theory that a lot of those jobs that have been lost are the jobs in these gig economies, with people driving Ubers, people doing deliveries, or jobs where they've been cut back just temporarily. And so perhaps we'll see a drop in the unemployment numbers in 3-4 weeks as things start opening up. But as some other people think, that the economy may not recover as quickly as possible because not everything's going to open up like it was back before this virus. There are a lot of businesses that aren't going to open up. Plus, there are businesses that have already laid off. They've seen revenues go down, and they don't see in the long term revenues going back up right away. So they've already laid people off, and it's unlikely that those people are going to get their jobs back in the short term. So these numbers are going to take a while, it seems, to get back to normal, I think.
Okay, let's go to Garret Martin. Garret, the United Kingdom is cautiously reopening parts of the economy and lifting restrictions. If we look at the past few days, people can now exercise. Schools will reopen on June 1st, and some parts of the hospitality industry will also be able to resume their activities. What does that tell us? That the trend or number of infections are going down?
They are. I mean, if you look at the curve of cases and death in the UK, they have gone down from their peak from April. However, they haven't gone down quite as fast as in other countries. And it's interesting, I think, when you're looking at the UK, to also look in comparison to some of the other European states. I mean, Ireland, for instance, has been more cautious in its plan to open up, and yet it has a far fewer cases than its peak back in April. So I think that's been interesting, first of all. Secondly, I think it's also, if you look at the reaction to Boris Johnson announcing the easing of restrictions, there was certainly some frustration amongst the UK public insofar as the vagueness of some of the instructions. They were suggesting that you could go back to work if you could, but you were also suggested to avoid public transport, which seemed to be a bit of a mixed message. There's concern about a bit of a rush to reopen schools by June 1st, but a sense that some of the important infrastructure, such as the contact tracing apps and the capacity to test rapidly, that's not quite ready for the reopening. So I think that it's fair to say that there is trepidation and anxiety. And there's also, I think, different reactions in the various parts of the United Kingdom. Scotland has been more cautious, for instance, than England insofar as easing restrictions.
Einar, China backed a review on the origins of the coronavirus pandemic earlier this week. President Xi Jinping, in fact, said that, yes, they will support that once this crisis is over. It will be conducted under the auspices of the World Health Organization, but it seems nothing is good enough because Foreign Policy magazine here in the United States says, well, the inquiry will not tell us much because China has a lot of influence in the WHO. So what are we to make of that? You can't win here.
Well, you can't win because that's the whole point. The narrative from the Trump re-election campaign is blame China. They certainly can't have any organization out there saying they're casting sunlight into things and saying everything was pretty much as described. That would be a crushing blow to Donald Trump. It's been a bad day in many respects for him on this front. The report coming out from Columbia University saying that more than a third of the fatalities could have been avoided if he had taken action sooner. Real questions about him not wearing a mask. What is going to happen going forward? Remember, Donald Trump, if there is a second spike, he's going to own it. He's gone against the CDC. He's gone against every scientist out there. And as a result, he's going to be pinned with any kind of consequences. Right now, you start looking at the figures, and you have an interesting corollary. About 6% more death rate based on the number of people identified as having the virus. And that's running just slightly below 6.5% for the world based on the numbers that are coming out through Johns Hopkins. So, this is a very serious thing. It's not like the flu. If he continues to treat it that way and there is a spike, his election is in essence finished.
Steve, it would seem that all of President Trump's actions right now seem to be driven by the November election in mind. Earlier on we were talking with Nathan King, our reporter, and he was telling us about the president's visit to Michigan, which is a key battleground state in this election. What's the plan here? What did he bring to the state today?
Well, I mean, he brought to the state really his campaign. I mean, as Nathan said, he was playing campaign music at this event. He was talking. He's really trying to talk to his supporters in Michigan. But it's a strange thing to watch because he has been fighting with Michigan's governor, who has higher approval ratings than the president does, and who's the people trust to handle coronavirus more than the president's doing. And so he's going to this state that he's picked a fight with and trying to really speak to people there as if nothing was any different, like it was just a random campaign event. And it's just odd because the president is going after Democratic governors in places like Pennsylvania and Michigan, for example, where he's going to need to win those states if he wants to win re-election in November. And so it's sort of an odd thing to watch. What he got out of it, I mean, again, he's going to places that matter in terms of votes in November. So he went to Michigan today, he's gone to Pennsylvania, he's gone to Arizona. There's talk that he's going to go to Florida soon for an official White House event, but usually these things are considered a de facto campaign event. And so clearly he's making decisions on his presidential travel to places that he thinks are going to benefit him electorally in November.
Steve, one other issue that we seem to be seeing in the news more and more often, there's a battle brewing here over what's known as mail voting, and the president is totally against that. Why is he totally against it? You know, in this time when we have a pandemic, you don't want people gathering on election day to cast their votes, so they want to do it via mail. But why is he opposed to it?
So he's not looking at it from a health perspective. He's looking at it from a political perspective. But the problem is he's basing it on two ideas that really sort of have been debunked. One is that he believes that the more mail voting there is, that there will be more fraud in terms of voting. And this is a discussion that is, this is an idea that is agreed upon by a lot of Republicans. They feel that generally this makes it easier for people to commit fraud, specifically Democrats. But he also believes that mail-in voting benefits Democrats, and there just isn't evidence to suggest that only Democrats would benefit from this. So, you know, he's doing it for purely political reasons. Yeah. What's interesting, there are Republicans around the country, including Republican governors and Republican secretaries of state, that are pushing for mail-in voting because they just want people to have a safe way to vote.
Okay, Garret, the United States government has invested $1.2 billion in the British pharmaceutical giant AstraZeneca. That's in order to speed up research into a vaccine. There's a promising vaccine which is being developed at Oxford University. Let's listen to what President Trump had to say about that today. Let's watch.
It holds tremendous promise, but we have many other companies who are just about as far along. We have many companies. We have the greatest pharmaceutical companies in the world. They're equally, you know, I mean, they're really in a position, and I'm not only talking about vaccine, I'm talking about cures and therapeutics. Therapeutically, we have some things coming out which we think are going to be great, but they have to be tested quickly, and we're doing it very quickly.
So, Garret, what do we know about this?
Well, you know, not that much for the moment, or at least it's not something that I've seen sort of significant headlines. I would suppose I'm not completely surprised that President Trump, who has framed a lot of his foreign policy in America first, would be framing the race to the vaccine as a competition. And I think politically as well, I think he is trying to, you know, that was mentioned earlier, to relentlessly push the message that, you know, better times are coming ahead. I think it's, of course, vital for his re-election, and he's constantly being overly optimistic. I think there is also an important incentive that if there is a vaccine, that you would then have to be able to rapidly ramp up distribution. And I think there's also sort of pressure that if you invest a lot in developing a vaccine, that then you would be able to allow your population to benefit first.
Einar, very quickly, China was able to get control of this virus, the outbreak, very quickly, but we are hearing of a new cluster in Shaolin, and it's forced a lockdown there. Very quickly, what can you tell us about what's going on there?
Well, they discovered a new cluster. Some part of it was from people coming in, and they just quickly locked it down. There's a lot of confidence that China is able, because of the ability to trace, treat, etc., that they can, you know, quickly determine who was involved, who was contacted, and take care of it.
Thank you. Thanks to all of you for being with us on the panel. That is it for this edition of The Heat. I'm Arlen Naidu in Washington, D.C. Thanks for being with us.